Thank you for joining us for this episode of Leading by Example, an informational video series where subject matter experts from Spectrum Healthcare Partners and Spectrum Management Services Company provide guidance and other resources to help patients, providers, and communities on timely healthcare topics. People's fears and anxiety were compounded by confusion in the wake of recent announcements that local healthcare organizations are furloughing staff. Patients are concerned that they won't be able to receive care during or after the pandemic subsides, and are having trouble reconciling that medical providers are experiencing a slowdown during a public health crisis. Many are aware that providers are continuing to deliver essential care, but don't necessarily understand what that includes or whether they can safely obtain this care if needed. In today's segment, Herbert Cushing, MD, Chief Medical Officer at Spectrum Healthcare Partners and infectious disease expert, will share information to help answer common questions and allay patient concerns about access to safe care.
Good morning, I'm Dr. Herb Cushing, Chief Medical Officer at Spectrum Healthcare Partners, and I'm an infectious disease specialist when I take care of patients. I look forward to answering your patient care questions today. With all of the worry and anxiety about people going to the hospital because that's where the COVID patients are going, we can't ignore the healthcare needs of folks who will continue to need to get care despite all the COVID problems. So if you need to go get health care, if you feel you have an urgent problem or a problem that needs to be addressed now, please go do it. It's very important that we don't let routine, urgent health care and essential care go unaddressed while we're addressing the nation's problems with COVID. People worry if they go to the doctor's office, they could get exposed to COVID, or they also worry that if they're carrying COVID, they might give it to others. So let me address those 2 points. Physicians' offices, urgent care centers, and emergency rooms now are set up to make sure that they screen patients before they come in to make sure that they're not sick with COVID. If they have symptoms that are consistent with that and don't have an emergency problem, they're asked to reschedule at a better date when they're feeling okay. For people that are well, after the screening, they come in and they're cared for with the appropriate personal protective equipment for both the healthcare provider and sometimes for the patients to make sure that the visit goes smoothly. We're telling people that we're providing essential care in physicians' offices. So let's talk about what essential care means. Essential is a condition defined by the physician and their patient. So examples of essential care might include people with cancer. So people with cancer need ongoing treatment who are actively getting radiation therapy or chemotherapy. They need to continue with that essential care. People with broken bones need to come in and get essential care because the broken bone needs to be cared for now, so that care can't wait. But there are other more subtle things that are also considered essential care. For example, patients may have intractable pain and be receiving treatments for the intractable pain, and that care can't be put off a month or 2 or 3 while we wait for COVID to get better. Those folks should continue to come to see us. There are patients with new conditions too that don't really know if their condition is serious or acute or essential. So please, those folks need to go to their doctor and have a discussion with a physician to determine whether or not they need to have continued ongoing care for something, or be reassured that it's a condition that could be addressed at a follow-up a month or 2 from now when the COVID issue is better. Telehealth is a wonderful way to see your doctor and to get many of your questions answered. We can even do through telehealth diagnosis of skin lesions and other things that formerly could only be done in the office. So please, if your physician's office offers you the option of telehealth, give it a try. I bet you'll like it. Especially walk-in clinics are a great way to get your healthcare needs met. They're a good way to get very specialized care from experts in individual conditions. Especially walk-in clinic like OrthoAccess can offer an alternative to going to urgent care or to an emergency room if you really know that you're dealing with a musculoskeletal problem. For example, OrthoAccess is a way to get your care for musculoskeletal conditions answered. We can handle all sorts of things from aches and sprains, from broken bones, to infections and get them addressed appropriately. One of the paradoxes of the coronavirus epidemic is that healthcare organizations that run because of patient receipts from the previous month may not have enough cash coming in to pay their providers to keep seeing patients, ironically. So people with regular medical conditions are not coming to their healthcare providers either out of fear or because of social distancing or because they don't meet the definition of essential care. Because of that, it's created a cash flow problem for many physician practices where they ironically can't continue to employ their staff and sometimes their physicians. So at a time when we need healthcare providers the most in this country, there are many areas where healthcare providers are being sent home with no work to do, where we have other healthcare providers in the acute care hospitals like critical care doctors, emergency room doctors, hospitalists, who have a lot more patients than they're able to take care of. The country needs certain healthcare workers now in areas where there's a lot of COVID. Examples of the healthcare workers who are needed can be folks from transportation people, technicians in certain key areas like radiology and laboratory, and it can go all the way up to physicians like anesthesiologists who have been trained in critical care but aren't practicing that now. We really need the help of those folks in areas where there'll be a surge of COVID patients. And in particular, I want to thank those healthcare providers for stepping up and providing care that's not quite like what they do on a regular everyday basis, but that is really, really needed by the country right now. This is Dr. Herb Cushing again. Thank you for tuning in today. And please, if you have questions about what you heard today, don't hesitate to contact us.